get married, don't just tell yourself, I don't check genotype. My genotype is AA, our genotype is AS, so we are good to go. Please check your blood group so that you don't belong to different resource factor. And sometimes when you try to even conceive for the first child, it might be difficult because there's probability your wife has gotten pregnant for somebody in a different resource factor and she did not take Rogam. It might be affecting your present conception. And for some women that have been able to conceive their first child, they might be finding it difficult to be able to conceive the second baby because of recurrent miscarriage. So are you a woman that after your first conception, after your first baby, you have been trying to take in, and whenever you take in, you have cases of recurrent miscarriage? You're always having miscarriage. Do you know the cause? Let me inform you of why you are having that miscarriage. It's because of blood grouping system. Some people, most times, if you want to get married, most people feel it's just genotype. Have you checked his genotype? Have you checked her genotype? Are you sure both of you are compatible? Yes, genotype is very essential. Just the same way blood grouping system is very essential. I want to educate you on blood grouping system. Ask Stevie Rachel, your online counselor. And of course, if you are yet to subscribe, if you are yet to join the family, don't forget to hit that subscribe button. Don't forget to follow us on all our social media platforms. And don't forget to book us for any counseling section of your choice. Let's talk about blood itself. Blood is like the life in man. So when your blood is off, of course, you know you're no longer in existence. So blood contains, one, the red blood cells. The red blood cells is also known as RBCS. It carries oxygen and carbon dioxide round the body. So when the red blood cells is out of it, you know that oxygen, carbon dioxide is not circulating around your body. Number two, which is the white blood cells, also known as WBCS. It helps to fight infection. So when that is absent, the ability to fight infection will not be in existence, so infection can see the end of you. Number three, which is the plasma. Plasma help in providing the needed salt and protein for the body to effectively function. So when that is off, the needed salt and protein that the body needs will automatically be off. Number four, we have platelets, which helps in clotting of the blood. You see those thick blackish blood when you have injury. Thanks to that blood, they help you from bleeding continuously for you to lose more blood. The difference in our blood, the difference in human blood, it's due to, or it's as a result of the presence or absence of certain protein molecules known as antigens or antibodies. Antigens is on the red blood cells, while antibody is on the plasma. That's why I first explained each of the blood cells, so that you can understand the difference. So antigens consist of the red blood cells, antibodies consist of the plasma. For the purpose of marriage, before you get married, open your ears. There are more than 20 genetically recognized blood grouping systems in this planet Earth. So before you get married, here are two conditions you should consider. Number one, childbirth. Number two, because of a condition named erythroblastosis fetalis. For the purpose of childbirth, you have to think that, okay, if I am in a certain blood grouping system and I need a donor, here are the blood group I should consider. So before you get married, you look at universal donor and universal recipient. That means if you know that you're a recipient, you cannot give out. When you want to get married, you look for a universal donor. I don't know if I'm making any sense. Blood group AB are universal recipient. Blood group O are universal donor. So look at this blood grouping system before you get married. If you are not well enlightened, ask your doctors to enlighten you, or you see your counselor to enlighten you. When you hear of erythroblastosis fetalis, it is a secondary infertility. Secondary in the sense that it allows you to birth your first child without problem. Then when you want to have your second, third child, you start to have issues, especially because of resource incompatibility. Incompatibility in the sense that if you are in a blood grouping system that is positive as a woman, and you get married to a man that his blood grouping system is negative, the moment you take in, it sends a signal that something strange is in your body, and it begins to fight. Before you know, miscarriage occurs. Before you get married, don't just tell yourself, I don't check genotype. My genotype is AA, our genotype is AS, so we are good to go. Please check your blood group so that you don't belong to different resource factor. And sometimes when you try to even conceive for the first child, it might be difficult because there's probability your wife has gotten pregnant for somebody in a different resource factor and she did not take RhoGAM. It might be affecting your present conception. And for some women that have been able to conceive their first child, they might be finding it difficult to be able to conceive the second baby because of recurrent miscarriage. So before you get married, please check your blood grouping system as much as you hold on to your genotype. And still remember Royal Care Counseling Outreach. My name is still Rachel. Don't forget to hit the subscribe button, follow us, and book for counseling. Bye bye.